Alright, so the topic for today is antifungal drugs. This is the chapter of unit chemotherapy of veterinary pharmacology, BVSc and AH third year. Alright, let's start. So antifungal drug, as the name itself says, very simple. The drugs which are used to suppress or prevent the growth and multiplication of fungi. These are called antifungal, antimycotic drugs. Okay. Now, before moving ahead to studying the actual types of antifungal drugs, we should know the types of fungal infections. So there are two types of fungal infections, superficial and systemic. Okay, let's start with superficial fungal infection. These are the fungal infections which affect the keratinized layers of skin and their appendages or mucous membranes. Okay, so it simply means that the fungal infections in which the only keratinized layer, so keratinized layer of the skin is the topmost layer of the skin. So only the keratinized layer of the skin and the appendages, for example hair follicles and sebaceous glands, all of those are affected, or the mucous membranes are affected. These type of fungal infection are called systemic mycosis or systemic fungal infection. Okay, so it is caused by the keratophilic fungi called dermatophytes. Okay, there is a keratophilic, so these type of fungi which causes infection, superficial infection, are called keratophilic fungi. Kerato means keratin and philic means affinity, so they have a high affinity for keratin, so these are called dermatophytes. Okay, and this class dermatophyte includes three genera of fungi, that is Mycosporum, Tragophyton and Epidermophyton. Now, before moving to the sign, we should know this point. Since these lesions, that is the lesions caused by these dermatophytes are ring shaped, so these are also called ringworms. Okay. So signs: alopecia, erythema, scale formation, exudation. Very easy. Erythema, that is redness; alopecia, that is loss of hairs; exudation, release of fluid; and scale formation. Okay. Now there is a term that is synonym for dermatophytosis, that is called tinea. Just forget these, only tinea. So there is a synonym for dermatophytosis, that is called tinea. Okay. So tinea or dermatophytosis are three types, and the structures involved three types: tinea capita, tinea pedis, tinea unguium. Okay. So tinea capita, dermatophytosis of the scalp. Tinea pedis, dermatophytosis of feet, and tinea unguium, dermatophytosis of males. Unguium, I think that's how I think that is pronounced. So dermatophytosis of males. Okay. So this was about superficial mycosis. Next we have systemic mycosis or systemic fungal infection. So it is the type of mycosis that affect the deeper tissue and organ, that is dermis and subcutaneous tissues. Very easy. Okay, systems of the body are being affected by the fungus. Now we'll talk about classification of antifungal drugs. So antifungal drugs can be classified into 6 classes. Okay, all the antifungal drugs can be classified into 6 classes. Okay, so those 6 classes are antifungal antibodies, antibiotics, antifungal antibiotics, antimetabolites, azoles, allylamines, echinocandins, and iodides. Okay, so antifungal antibiotics include 2 subclasses: polyenes and heterocyclic benzofurans. So polyene include AMB, which stands for amphotericin B, nystatin and netamycin. Heterocyclic benzofuran includes griseofulvin. Alright, now antimetabolites include flucytosine. Azoles include imidazole and triazole. Imidazole include ketoconazole, miconazole, and clotrimazole, KMC. That is the mnemonic which I made. And triazole include fluconazole and itraconazole, FI. Okay, by 5. Okay. And next over allylamines, it includes terbinafine, butinafine, and neftifine. And echinocandins include capsofugin and micafugin. And iodides include sodium iodide and potassium iodide. Alright, let's move ahead. So now we'll study the mechanism of action of each of these classes and subclasses. So we first start with polyene antibiotics. Okay, so polyene is made up of 2 words, poly and ene. Poly means many, ene means double bond. In organic chemistry we study that ene means double bond. So these are the chemical structure of polyene antibiotics, include multiple double bonds. Okay, and source of polyene antibiotic is actinomyces, fungus actinomyces. Okay, so now amphotericin B is the prototype drug of polyenes. Okay, we have to learn this. Okay, so mechanism of action. So amphotericin B or any polyene antibiotic is administered. Okay, what happens then is these drugs have high affinity for ergosterol of the fungal cell membrane. So these drugs are administered, these will reach the site of fungal infection. These drugs, that is polyene antibiotics or amphotericin B for example, this is a prototype drug of polyenes. These have very high affinity for the sterol of fungal cell membrane. So as you know, in the sterol of mammalian cell membrane, that is cholesterol, but the sterol of fungal cell membrane is ergosterol. Okay, so they have very high affinity for ergosterol, that is the sterol for fungal cell membrane. These drugs will reach the site of fungal infection, they will interact with ergosterol, and this interaction will lead to the formation of pores or spaces in the fungal cell membrane, that is, this will disrupt the fungal cell membrane. or damage the fungal cell membrane. Okay, and these spores will cause two functions. Okay, the first effect, the two types of damage. First, there will be leakage of important nutrients from the body, from the cell, fungal cell, sorry. And second is, these spores will lead to the alteration of potassium hydrogen ions, leading to excessive influx of hydrogen and efflux of potassium ion. Okay, so this point is simply trying to say that there will be excessive influx of hydrogen ions and efflux of potassium ion because pores have been formed, or cell membrane of the fungus has been damaged. Okay, so now since excessive influx of hydrogen is taking place, this will create acidic condition inside the fungal cell, and this will disrupt the metabolic processes within the fungal cell, and this will lead to fungal cell death. Very simple. Okay? So amphotericin B at normal doses is fungistatic and at higher doses is fungicidal. Okay. Now, one point which you need to remember here is that the degree of specific toxicity which is shown by antibiotics is not shown to that degree by antifungal drugs. Okay, so we'll talk about AMB, that is amphotericin B. So it is relatively host specific because it binds to ergosterol and not with mammalian cholesterol, that is animal cell cholesterol. It will not bind to those, it will bind to ergosterol, but it may bind to cholesterol, that is why it may harm the host cell as well. So that is what this point is trying to say. Okay, next we'll move on to heterocyclic benzofurans. Mechanism of action. The heterocyclic benzofurans, the drug which you have to study is griseofulvin. Okay, so first we'll move on to these points. Griseofulvin is obtained from the fungus Penicillium griseofulvin and its route of administration is oral. Okay, alright. So mechanism of action. What happens is, these griseofulvin or heterocyclic benzofuran, these are administered, these reach the site of fungal infection, and these enter the fungal cell through an energy dependent transport system, that is EDTS. That abbreviation I made this morning, EDTS, energy dependent transport system. Okay, not a standard abbreviation. Okay. Now what happens? These drugs interact with the microtubular protein. So these drugs will, heterocyclic benzofuran or griseofulvin, which is in our syllabus, it will enter the fungal cell through energy dependent transport system. This will then interact with the microtubular proteins, and after interacting with microtubular protein, as you know, microtubular protein is involved in a spindle formation. Okay, so there will be interference with the spindle formation in dividing fungal cell. Okay, so now when no spindle will be formed, so what will happen here is, what these fungal cell, the dividing fungal cell, will be arrested in the metaphase stage. Okay, so they will be arrested in the metaphase stage. Okay, in the metaphase stage, and this will lead to the formation of multinucleate fungal cell, and these multinucleate fungal cell will not be able to survive, thus lead to fungal cell death. Alright. Now, third is antimetabolites. The antimetabolites, that is mechanism of action, we will talk about. The flu cytosine you have to study. Okay. Now, first point which you need to understand is, flu cytosine show very high degree of specific toxicity as compared to other antifungal drugs. Why? Because of the fact that flu cytosine enters the fungal cell through a specific cytosine permease protein, and this cytosine permease protein is found only in fungal cell membrane. Okay, not in mammalian cells. Okay. So what will happen is, this flu cytosine or antimetabolite will enter the fungal cell by a permease protein, and as soon as it will enter the fungal cell, it will be converted into 5-fluorouracil, okay, or 5-FU. And this 5-fluorouracil actually has an antimetabolite property, and because it competes with the formation or synthesis of uracil. Uracil, as we know, it is a base pair of RNA, so there will be interference with the synthesis of RNA. So one function is performed here. Okay. Now this 5-fluorouracil will be converted into 5-FUMP, 5-uromonophosphate. Okay, 5-uracil monophosphate. Yeah. So now this 5-FUMP will be converted to 5-UTP, FUTP, and 5-FDUMP, FDUMP. So 5-urotriphosphate and 5-DUMP. Okay, and this 5-DUMP is actually an inhibitor of thymidylate synthetase enzyme. This thymidylate synthetase enzyme is important for the fungus because this enzyme is used by the fungus for the synthesis of thymidyllic acid, which is used for the synthesis of thymidine, which is a base pair of DNA. So this enzyme is inhibited, there will be no synthesis of thymidyllic acid, there will be no synthesis of DNA, and there will be the cell division of fungal cell will stop. Okay, so this is fungistatic. So this is the point of selective toxicity which we have discussed. Now flu cytosine plus amphotericin B. So this combination is a very good combination because flu cytosine plus amphotericin B, their effect is synergistic. So as you already know, synergistic effect, that is the effect which will be produced when these two drugs are administered separately, will be less as compared to when they are administered together. For example, if the effect produced by this is 2 and the effect produced by this is 2, so the synergistic means 2 plus 2 will be more than 4. Okay, so Now, why are we administering these two? Because they have a synergistic effect. So why does they have synergistic effect? Because anti-metabolite allows more flu cytosine to enter the fungal cell by increasing the fungal cell membrane permeability. So as you already know, amphotericin B is responsible for damaging the fungal cell membrane or increasing the permeability of fungal cell membrane. So more and more flu cytosine will be able to enter when amphotericin will damage the fungal cell membrane. Okay. Alright. So flu cytosine is fungistatic, as we have discussed. So now one point you should be remembered is the dose of amphotericin B should be hard when used in combination with flu cytosine. Okay. Now next we have azoles. So azoles, these are a group of 5-membered heterocyclic compounds. These are a group of 5-membered heterocyclic compound that is a ring-shaped structure containing nitrogen atom in the ring as well. There will be 5 different heterocyclic elements, atoms, out of which few will be nitrogen. Okay. So on the basis of the number of nitrogen, azoles can be divided into imidazole and triazole. Imidazole means 2 nitrogen atom, triazole means 3 nitrogen atom. Okay. Now both mechanism of action of imidazole and triazole is same, so we will study with respect to azoles. So azoles are administered and they will act on the fungal cell membrane, and this will inhibit the synthesis of ergosterol. And the pathway which they use, which this azole drug used to inhibit the ergosterol synthesis, is by inhibiting the enzyme 14-alpha demethylase. Okay. There is an enzyme in the fungal cell membrane which is called 14-alpha demethylase, and these drugs inhibit this enzyme. Azoles inhibit this enzyme. This enzyme is inhibited, so ergosterol synthesis is inhibited. Now the effect will be the same as compared to amphotericin B, similar to amphotericin B, because as soon as the membrane permeability, as soon as ergosterol will not be synthesized, this will damage the cell membrane of fungus. Membrane permeability of the fungal cell membrane will be altered and this will again lead to the influx of hydrogen, efflux of potassium. So this will lead to creation or generation of acidic conditions within the fungal cell. This will damage the fungal cell, disrupt the metabolic process, this will lead to fungal cell death. Okay. So now this point regarding this, that is imidazole. Ketoconazole is one of the imidazole, ketoconazole, miconazole, clotrimazole. These are imidazole, and triazole include fluconazole and itraconazole. So ketoconazole is the first azole that could be given orally to treat systemic fungal infection. So it was the first azole to be developed which was given orally, or which is still given to treat systemic fungal infections. It is a prototype azole drug and it is a broad spectrum antifungal activity. It has broad spectrum antifungal activity. Okay. Next we have got allylamines. Allylamines, mechanism of action is as follows. So these drugs, for example, terbinafine, butinafine, netifine, okay, these drugs are administered. These will reach the site of fungal infection. These drugs will now again, these will also inhibit the synthesis of ergosterol, but through a different pathway that is called the inhibition of the enzyme squalene epoxide enzyme. Squalene epoxide enzyme will be inhibited by these drugs, allylamines, and this will enzyme, since it is involved in the synthesis of ergosterol, no ergosterol will be formed. So this will lead to the disruption of fungal cell membrane, fungal cell death, that is fungicidal effect. So this is the mechanism of action of allylamines. Okay. And last we have got echinocandins. Okay. So echinocandins, these are the this point is kind of important, obvious, because these echinocandins are called penicillin of antifungal drugs, because as you know, penicillin group of antibiotics, these are responsible for inhibiting the bacterial cell wall growth. So here these are called echinocandins are called penicillin of antifungal drug because they inhibit the synthesis of fungal cell wall. Okay. So how do you do it? Mechanism of action. So these drugs are administered. These echinocandins are administered. For example, castrofugin, micafugin. These are administered. These will reach the site of fungal infection, and then what they will do is they will inhibit the synthesis of a particular enzyme that is called beta glucan, not enzyme or compound, that is called beta glucan. Okay, which is found in the fungal cell wall. And the importance of this beta glucan is that this leads to the weakening of integrity of fungal cell wall. Okay, so integrity of fungal cell wall will be weakened. Okay, so this will lead to damage of fungal cell wall. So the action of echinocandins is both fungistatic and fungicidal. Fungistatic against mold and fungicidal against yeast. So it can be learned by YC. Y Combinator is a company, the YC. Yeast, sidal, fungicidal yeast, fungistatic mold. Alright, thank you.